Welcome to LINNC 2024. I am Miriam Vicente from Argentina, and I'm here with Dr. Markus Möhlenbruch from Germany. It's a pleasure to be with you here.
Thank you.
We are talking about MeVO thrombectomies now. Why do we have taken account the difference between LVO and MeVOs?
So if you look to the literature, there are different registries available comparing large vessel occlusions with MeVOs. On the first impression, you might get to the conclusion that there is no real difference regarding the outcome, the recanalization success, and different safety parameters. But if you look a little bit more into the details, especially if the M2 segment is excluded, for example, then you see that there are differences in terms of recanalization rates, which are actually lower in MeVOs, and that there is a higher rate for any type of intracranial hemorrhage.
What or where are the challenges to perform MeVO thrombectomies?
So basically, for example, when we look to the MCA territory, there is this junction between the M2, M3 segment, so the insular segment and the opercular segment, where you have at least a 90-degree curve or even more. And when you place a stent retriever or an aspiration catheter at this level, and you start with the retrieving of this device, in almost all cases you will straighten the whole vessel course. But the problem is that, especially in this area, you have a lot of tiny branches, corticomedullary branches, and because of the straightening you will dissect, or the risk at least is that you can dissect these branches, and this might lead to an intracranial hemorrhage.
And what is the key message you want to leave here in LINNC this year?
So basically, if you treat a MeVO, then you should adapt your treatment technique. So the idea is not to use the same technique which you use for large vessel occlusion. So you should definitely take a stent retriever, for example, which is dedicated to smaller vessels, so which means it's a smaller device in diameter and shorter in length. So this is one option. Also, you can go for aspiration, and then this is obvious, you have to use smaller and more flexible aspiration catheters. But I think from my perspective, if you combine these two treatments, probably, and at least according to some meta-analysis, you will have the highest rate of recanalization. And with using an aspiration catheter in addition, you might at least reduce the problem of this vessel deflection in order to reduce the rate of intracranial hemorrhage.
Thank you very much. It was a pleasure to have you here.
Thank you.